Welcome to today's discussion on vector-borne diseases. These diseases are amongst the most complex of all infectious diseases to prevent and control. Not only is it difficult to predict the habits of the vectors, but most vector-borne agents can infect animals as well. Although there are many vector-borne illnesses, during this video you will learn more about three specific ones: West Nile virus, the three forms of plague, and Murine typhus.
I'm Supo, and today we will be discussing on three vector-borne diseases and issues of carrier states of these three diseases. First, let's define carrier state. It is the continued presence of an organism, such as bacteria, virus, or parasite in the body that does not cause symptoms, but is able to be transmitted and infect other persons.
Let's talk about some similar characteristics that the three diseases have. Once infected, a febrile illness sets in, which usually lasts a week or less. It's accompanied by a fever, headache, malaise, arthralgia or myalgia, and occasional nausea and vomiting. Some differences are as follows. With Murine typhus, one will have a dull red rash that begins in the middle of the body and spreads. Extremely high fevers between 105 and 106 degrees Fahrenheit, which may last up to 2 weeks, is also common. In terms of the different forms of plague, lymphadenitis is commonly seen with bubonic plague, bloodstream dissemination is seen with septicemia, and pneumonia or pleural effusion is seen with pneumonic plague. Encephalitis is seen with West Nile virus.
Both West Nile virus and murine typhus are transmitted strictly from an infected animal to a human and not from human to human. As for plague, there are basically three forms: bubonic, septicemia, and pneumonic plague. Both bubonic and septicemia are strictly contracted through the bite of an infected rodent or bug. It does not pass from human to human. Unlike the other two types, pneumonic plague can spread from person to person through inhalation of fine infective droplets. It does not occur through the bite of an infected flea. Hence, pneumonic plague is not exclusively vector-borne such as bubonic plague. Instead, it can be spread from person to person. A person who is the carrier of pneumonic plague bacteria could unknowingly carry the infectious agent and transmit it to another while coughing or sneezing.
All three diseases are common and have incidence in high poverty-stricken countries like Africa. Murine typhus is found worldwide and in areas where people and rats occupy the same building. According to Hyman, there has been no person-to-person transmission of plague in America since 1924. 5 instances of cat-to-human pneumonic transmission have been recorded. Similar to other communicable diseases, diagnosis is based on signs and symptoms and lab and diagnostics tests. West Nile virus can be seen in cerebrospinal fluid, and a PCR test can be done. With the different forms of plague, blood culture, culture of lymph node aspirate, and culture of sputum is used in diagnosis. A CBC may show thrombocytopenia, anemia, and high levels of typhus antibody. Thank you for watching, and we hope you learned something new about vector-borne diseases.